welcome back to Check Up with Bluegrass, a podcast where we talk about the care and services available right here in our community. I'm Rob Stromberg, and I'll be your guest host today. Recently, Bluegrass Community Hospital joined our sister facilities in Georgetown, Winchester, and Paris under a new name, Centerpoint Health. While our name and brand may be new, our mission remains exactly the same, making communities healthier, especially right here in Woodford County. With our name change, we'll be renaming this podcast to Check Up with Centerpoint Health. Same conversations, same healthy topics, but with a new name to better reflect our future as Centerpoint Health. Today, we're focusing on heart health, which is perfect timing as February is American Heart Month. I'm honored to be joined by Sarah Bond, an advanced practitioner provider who served at our full-time cardiology provider right here in Versailles. Sarah, thanks for being here today. To start us off, when you think about heart health in our community, what do you think people should know or understand better?
Thanks, Rob, for having me. The biggest thing to get across is letting the community know that we actually have cardiology services and care here in town for them, that they don't have to travel far to keep that management going and get evaluated, and that our hospital offices offers advanced imaging services, and so that we can get their testing done here as well. So keeping that care close to home. And I think that's the biggest takeaway that we need to get the community aware of, because I just joined you all around 2 years ago to give that availability, and that we've even put a satellite clinic out in Lawrenceburg for that convenience as well. So letting them know that they can get that cardiology care close to home.
It's great news. Thank you. Heart disease is something we hear about often, but many people feel fine day to day. Why is heart health something people should be proactive about, even if they don't have symptoms?
So you only have one heart, so we need to treat it well. And with a lot of diseases that are out there, sometimes you know right away those symptoms are showing. But a lot of heart disease we consider silent, and sometimes they even use aggressive words like silent killer, and that's if your blood pressure is not being controlled because the damage is being done. It can cause an inflammatory response throughout your whole body and actually result in plaque buildup. And so even though maybe your cholesterol is good, you're dying, you're eating well, but if that blood pressure is not controlled, it could be doing damage. And it could be doing damage to your kidneys, your heart, and to all the vessels that do all the work for us. So you may be feeling fine, but if you're not going to those primary care appointments, getting those wellness exams, getting those things checked, you might not recognize that things are not going well on the inside for you. So the best thing we can do is preventive.
Excellent. You mentioned some vital organs inside our body. So in line with that, what are some common warning signs or symptoms related to heart health that people just shouldn't ignore?
You know, a lot of people, when they think about the heart, they think about the typical signs, the chest pain, tightness in their chest, and obviously do not ignore that. But I think there are some other signs and symptoms that people don't really recognize that are related to the heart, and that is the swelling in our legs, the progressing shortness of air. You could do those flight of stairs, and now you can't. Now you're more winded. You're more tired after doing some type of activity, working in the garden, walking around Kroger's or what have you. Things are just kind of wearing you out more. Those are actually kind of those vague symptoms that actually could all be stemming from your heart struggling, or your blood pressure, or even your heart rate being a little abnormal. So I would not only think about those scary signs that we all know about, we've seen on the TV, we've seen in sitcoms and stuff about the crushing chest pain, but those other symptoms that could just be fatigue and tired.
Mm-hmm. Yeah, so you mentioned all these things around our daily activity. Are there symptoms that tend to show up differently in women that people may not recognize as heart-related?
Absolutely. So we as women, we tend to downplay a lot of things. We're used to taking on a lot. And then in general, sometimes chest pain just does not present as that crushing tightness that's radiating to your left arm, radiating to your jaw that we typically hear about chest pain. And what they really experience is what they think is a panic attack, but it's out of proportion to what is going on, and they can't catch their breath. And so they get very short of breath, they get very anxious feeling, and that is actually could be a sign of a massive heart attack. That was the symptoms my mom had when she was having a heart attack at home. And they wanted to treat her for anxiety and an inhaler and stuff like that until they did that 12-lead EKG, and then she got a stent and so forth. So it's quite common that women kind of downplay it a little bit, and it builds up and ends up feeling like an anxiety panic attack. So there's nothing wrong with ever getting checked out, and especially if it's out of proportion. If you don't have a reason to be anxious and panicky at that moment, and your normal things that you usually do for your anxiety and panic are not working, and your heart is racing, it might be worth getting evaluated.
Excellent information for women. Thank you. One thing we're really proud of is being able to offer heart care close to home. So can you talk about the cardiology services available right here in Versailles?
Yeah, so I kind of mentioned that because that's also something I'm quite proud of to be able to offer. My experience coming from working at UK in advanced heart failure, managing heart transplants and mechanical hearts has given me a lot of experience and knowledge and community and relationships with a lot of the providers in Lexington and those areas. And being able to offer that management and keep those relationships with those larger institutions is something we should be quite proud of, and it's great for the community because transportation is an issue for a lot of people, and a lot of reasons we get admitted to the hospital for management is because we can't get into those clinicians to get those early signs managed. So we start feeling like we got the weight gain or the shortness of air or the chest pain. You call to get an appointment, and it's months out. And by that time, things are getting out of hand. So we can get you in right away. Next day appointments. You can come without a referral just to get it checked out and evaluated. We can do lots of screening with echocardiograms, stress tests, and we are now offering coronary artery calcium scans here right in Versailles.
Amazing, yes.
So, letting you know those things that we can manage and get preventive. So.
Well, thank you for that, Sarah. Obviously, you're highly skilled in your area of service, and we thank you for that, and thank you for being in Versailles. So along with that line, what types of patients are you seeing most often in your Versailles clinic?
I feel like I see the whole variety. I can see just a simple preventative or a simple evaluation, people kind of wanting to know or do all the right things, and I'm happy for that. I'm all about preventative care. To the more advanced, the heart failure that is far gone and needs management so they can stay out of the hospital, to arrhythmias like atrial fibrillation. Atrial fibrillation has really increased in incidence. So it used to be the saying, about anyone after the age of 60, 65, about 11% were going to get AFib. It's up to now they're thinking 25% of people. So that's a common arrhythmia that really ends up in my office.
You already kind of talked about it. We kind of segue into this question. Well, maybe you can expound on it a little bit more. How does having a full-time cardiology provider locally and now in Lawrenceburg make a difference for patients?
Keeps you out of the hospital. I would say that's your biggest takeaway. You want to stay out of the hospital? Come to the cardiology provider that can get you in close to home and treat you like family. And they're going to follow up on those items and keep things managed, get those labs done, follow up on it, and help you stay out of the hospital. You need sometimes that quick, easy fine-tuning, and you need that easy access. So offering that close-to-home care is where that comes. It makes it where the appointments don't seem like such a burden. And then a lot of insurance companies do allow to help with transportation if people feel like that is an issue. You can actually make sure you're calling your insurance company and seeing. But I would say that we all go above and beyond. Even you here, you have went to my patient's house to put a monitor on for me, or I can have them swing by and stuff. So I think that's it. It's quick care.
Mm-hmm. It's convenient, but it's also necessary and important. Thank you. If someone, those that are listening today and those that will be listening in the future wants to be more proactive about their heart health, what are a few practical steps they can start taking today?
It's progress over perfection. Don't try to do anything perfect. It won't last. Don't do anything cold turkey. So it's making those little steps. And if those little steps mean Choosing a water over a soda that day, do that. If those little steps mean taking the stairs that day instead of the elevator, do that. Anything like that is going to make the biggest difference. So choosing the salad over the fried food that one day, those little changes will go a long way. And then getting in and getting those evaluations, those wellness appointments, just to make sure the blood pressure is controlled, the cholesterol is controlled, the diabetes controlled. I mean, those are our big risk factors. If you come in here complaining of chest pain or any of those kind of cardiac symptoms that kind of alert our ears and our eyes, if we find out that, one, you've never been to a doctor, or two, your diabetes hasn't been well controlled or your blood pressure's not been well controlled, there's a good chance that it is going to be a real cardiac event, because all of that underlying untreated disease starts building up.
So if I'm in the office and I'm sitting at my desk quite a bit, do like leg squats help per hour? Like if I do so many squats an hour in my, in my office, or?
So there's a lot of sayings now that you can be just as effective if you get up and do 10 squats an hour, 8 hours a day. It's just as effective as if you were going to the gym 30 minutes a day. That can improve your cardiovascular care and decrease mortality and morbidity. So, I mean, it's a huge thing. So that's where I'm saying taking those stairs, doing those little things will actually make a huge difference. So and also the other big thing I think patients do is they're like, oh, well, I messed up today, so might as well just throw in the towel. You got to get rid of that mindset. Just because you got that chili dog, and don't get me wrong, I like my chili dog. I just try to limit them. It doesn't mean my whole day is going to be thrown off. I just try to choose better at my next meal or drink or so forth.
And that's good. It's important, like if you work remotely and you're sitting at home, and you can do this while you're sitting at home in your chair and hop up and do 10 squats. So even during a commercial break. Excellent. How important is it for people to know their numbers? Things like blood pressure, cholesterol, and most important, family history.
Family history plays a huge part. So I would say that's something that a lot of people, we don't realize. Maybe families didn't talk about it. People didn't talk about their illnesses. They didn't explain. Maybe you've got distance. But that can tell you a lot of what's going to possibly happen. It is said to be more genetic if a male has experienced a heart attack before the age of 55 or a female before the age of 65, that it's going to be in your genes, and that's when you really want to be on things and controlling them. And then there's certain genetics that control. You could do everything right, and it won't matter. Your cholesterol is in your genes, and so we've got to have you on the meds. Or you could do everything right, but your blood pressure, it's in your genes. We've got to have you on meds to control it. And sometimes it takes up to 3 different class medications to actually control it. So knowing those numbers, knowing that you really want those blood pressures around 120 over 80, that you want that heart rate less than 110 when you're at rest, that you want that cholesterol, LDL less than 130, triglycerides controlled, those kind of things. It's important to know your numbers and how they trend, because it's the overtime of those numbers that does the damage.
Excellent. Thank you for that. At what point should someone consider seeing a cardiologist or cardiology provider instead of waiting or just managing things on their own, which I'm sure many individuals are guilty of?
I think a lot of it is symptoms. Again, I think everybody should be seeing their primary care once a year. But I think a lot of it, you need to move on if you've got symptoms. If you feel like your heart's racing here and there, go get it checked out. If you feel like you're getting chest pain with activity that goes away with rest, go get it checked out. Don't just chalk it up to, oh, it was hot today. Oh, it's because I didn't eat enough or drank enough today. I mean, if these things continue to reoccur, there's possibly something's going on deeper down. And what's it going to hurt? You come and get it checked out. I say everything good, then you sleep better at night.
I agree. Sometimes we do kind of pass those things over and like you said, it's just health, or it's just bad weather, or my knees are bad. So excellent point, because I'm also guilty of that sometimes.
Yes, you are.
Do patients need a referral? You mentioned this before, but we're going to reiterate it. Do patients need a referral to be seen, or what does that process typically look like for a patient?
So it's insurance companies that really determined if you needed a referral, and a lot of them got rid of that. So you would, if you're really worried about it, check your insurance policy. That is who has determined, do you need a referral, do you not? But so really, you don't need a referral. I saw a patient today, and his son was with him, and he was like, "How do I get seen by you?" And I said, "Well, you just walk out there and submit your information, and that's all you got to do." So it's as simple as that. We do want to know if you have seen a primary care provider, if you've had cardiac workup before, because I am not about repeating tests that you have recently had done. I'm not here to waste your money. And so if I can get records, that's way more beneficial instead of us having to repeat everything. So providing that information, bringing any records, that's great, but you don't have to be seen. So you can always call our office. We even have an online ability that you can self-schedule yourself without, if you're like me, I hate to talk on the phone. So if you give me the ability to access something virtually and get myself in, that's what I'm going to do. And so you can do that for all of the clinics. And then if you're seen in the ER, I've kept all my 9 a.m. slots open for any ER follow-up. So you can just show up in my clinic and just say you were seen in the ER for cardiac reasons, and I'm going to, take you and evaluate you.
It's good to know, and there's no excuse not to be seen by you. Before we wrap up, what's one message you want everyone listening to remember about heart health?
You only get one heart, so let's take care of it. Progress over perfection, and know that you have access to some great cardiology and some great providers in general here in Versailles, as well as once you meet us, it's the same people every time you come in. We are consistent, and so that's really nice.
Sarah Bond, thank you for sharing your experience today and for the care you provide to our community every day and again in Lawrenceburg. If you'd like to schedule an appointment with Sarah Bond and the team at Centerpoint Cardiology in Versailles, visit us online or give us a call to learn more. As we transition to check up with Centerpoint Health, we're excited to continue bringing you important conversations that help you live healthier. This February, take a step toward prevention because your heart health matters. Thank you for listening.
Thanks.